This training aid was developed to help address the clear gap in education and skills evident in the field of substance misuse treatment. One of the main ways people suffering from addiction problems are offered support is through some form of activity in groups. However, professionals who lead these groups all too often don't have a framework to understand how best to use groups. There is an absence of a theoretical model and a lack of understanding of what is likely to be helpful in a group. What you see presented here is influenced strongly by the work of Irvin Yalom and Philip Flores, who have both written extensively on this topic.
Yeah, I've got something I need to bring to the group.
Jimmy, could you go on, please?
It's my mum. She died last year. I used to care for her. I used to have to give her a medication. To stop her from being in pain. But I used to steal them. Steal them just for a hit.
Thanks for sharing that, Jimmy. That's pretty big stuff.
We've all got secrets, mate.
I've done stuff I'm not proud of.
It's not just you, Jimmy. When I was using, none of my family wanted nothing to do with me, except for my granddad. He's the only one I had in contact with. He's pretty old though. He used to send me down to the post office to get his pension every week. And I used to nick the money because I needed it to use.
It's just money. This is medication. Medication that actually stopped her from being in pain.
I've stolen from my family. It might not be the same circumstances. I can certainly relate to the feelings of shame and guilt.
How did you cope, Jimmy?
Drugs. Heroin, meth. Just anything.
That's where our addiction takes us, bruv.
Jimmy, this is really brave of you to bring us to group.
Jimmy, do you think you could let the group know what it is about the group today that's allowed you to share this?
The other day, Gemma. She got vulnerable, like real vulnerable, like I just felt closer to her. Really close.
I'm wondering if you answered my question there. What was it, do you think, about this group that let you share that?
I don't know really. Maybe it's the trust, like I sort of trust them. No, now you all know the real me.
Jimmy, it sounds like you've been holding this in for quite a while. What were you worried about? What were you frightened about if you told the group about this?
What was I afraid of? Who's going to respect someone like me? Who's going to respect someone that steals medication off their mum?
Hasn't changed the way I feel about you, Jimmy.
That took a lot of guts.
Yeah, you've done really well to trust her.
What you've just done, I could never do that. It's really brave.
Just remember, it wasn't you, Jimmy, it was the addict.
Jimmy, I just think it was great that you managed to get it out there.
During this process, Jimmy is clearly sitting in a lot of discomfort. And when he finally speaks, the rest of the group appear to detect this and give rapt attention. It's clear something different is going on now. Disclosures such as Jimmy's can be fairly common in addiction support groups when there's enough cohesiveness in the group and readiness in the individual to disclose. They can be very powerful agents of change for a number of reasons, but should never be forced. Some clients get the message from certain treatment philosophies that you're only as sick as your secrets, or that unless you expose your shame, it will eat you up and sabotage your recovery. There's actually no evidence to support either of these views. However, if and when people are ready to disclose shameful aspects of themselves, it gives a clear message of trust, which almost always brings the group members closer together by giving others permission to take risks and make further disclosures themselves. There are a number of benefits for the group and for the individual in this. As other group members identify with Jimmy, they also are taking risks and exposing their vulnerability, entering into the circle of trust with him. However, Jimmy seems too wrapped up in his remorse to receive the gifts offered to him at first. But the communication clearly takes the group to a much deeper and more involved level of interaction than previously. Even Mark shows some interpersonal sensitivity with his identification, rather than focusing historically or on the content of the disclosure as Nathan does. Jax takes the opportunity to stimulate the second stage of interpersonal learning, in the here and now. After the first stage, a genuine, emotionally laden interpersonal experience has occurred. The therapist has the opportunity to help the group illuminate the process. In this case, Jax invites what we might call a meta-disclosure, a disclosure about the disclosure, pointing the group into the here and now, inviting them to explore what the event said about the relationships between the people in the group. By asking what allowed him to share his story, Jim is able to highlight how another member of the group has affected him and how he feels towards them as a result. Jax probes further and Jim is able to highlight how he's developed trust with the members of the group. This will have a tangible effect on the relationships with the other members and on the group as a whole. But by saying, "Now you all know the real me," Jimmy betrays continued feelings of shame. So Tim offers another classic intervention designed to elicit further meta-disclosure by asking what he was afraid would happen if he shared this. Jimmy is then able to identify the root of his shame in the group, that people would reject him and disrespect him. This reveals an even deeper level of intimacy as he shares his fears. However, the feared catastrophe doesn't occur. People are quite clear that, on the contrary, rather than looking down on him for his past actions, They admire and respect his current honesty and courage. When someone realises that they are not judged by others about historical actions for which they judge themselves, it can be a great help to that person to give up their self-judgment and put those events in the past.